Welcome to this explainer. Today, we're diving straight into the absolute gauntlet that is the 75-week journey to becoming a licensed practical nurse. If you've ever wondered what it actually takes to transform from a student into a fully fledged frontline healthcare professional, well, you're in exactly the right place. We're going to break down the whole progression, the intense clinical hours, the strict standards, the whole shebang required to make this career a reality.
Here is our roadmap for the breakdown, recovering the call to nursing, those strict BCCNM practice standards, the hands-on clinical experiences, the preceptorship phase, and finally, conquering the RXPN exam. Let's get right into it.
1,965. That's the total number of program hours required to earn this diploma. I mean, just think about the sheer scale of that commitment. Over the course of 75 weeks of full-time study, this curriculum demands an incredibly high level of dedication. It blends intensive classroom theory with hands-on practice, and honestly, it is rigorous by design. Why? Because the job demands absolutely nothing less. And all of those 1,965 hours really serve one critical purpose, right? Preparing you to become a licensed practical nurse. By taking this on, you're preparing to join the second largest nursing group in Canada. LPNs are, without a doubt, essential frontline heroes. They use a highly systematic process to assess, plan, implement, and evaluate holistic care for diverse clients across their entire lifespan. Whether a disease is actively progressing or a patient is in a palliative stage, LPNs are right there, standing on the front lines.
And when we talk about where this intensive training actually happens, a great example to look at is the Practical Nursing Program over at CDI College. Their diploma program is uniquely designed to actually meet the real-world family, economic, and lifestyle needs of a modern student. It offers a really adaptable option while still maintaining a razor-sharp focus on both practical and knowledge-based skills.
Moving on to Part 2, Strict BCCNM Practice Standards.
Okay, so before you can even think about touching a patient, you have to master the rules of the realm. These are the regulations established by the British Columbia College of Nurses and Midwives. Your entire education is deeply rooted in 5 absolute pillars. First, professional practice, making sure you act safely and accountably. Second, ethical practice. Third, legal practice, which means adhering to all provincial and federal laws. Fourth, the actual foundations of practice, using that systematic nursing process we talked about. And finally, collaborative practice, because let's face it, you'll never work alone. You're always part of a broader healthcare team. Literally everything an LPN does maps directly back to these 5 competencies.
But you know, this journey requires more than just memorizing rules. It requires immense empathy. You'll learn to apply an ethical framework that truly honors the dignity and individuality of every single person you treat. You've got to build therapeutic, culturally safe relationships and really respect a client's right to self-determination, acknowledging their unique complexities at every single stage of their life.
But here's the catch, that deep empathy has to be balanced with structure. As you progress, you'll learn to navigate the critical, sometimes tricky distinction between your ethical duties to your clients and the strict legal boundaries an LPN has to function within. You'll be balancing client confidentiality, strict legal documentation requirements, and a full understanding of your own legislated scope of practice. It's a delicate but absolutely vital balance.
That brings us to Section 3, Hands-on Clinical Experiences.
This is where the textbook theory finally builds into real-world application. We're talking about 4 escalating clinical trials, known as Clinical Practice Experiences, or CPEs. And your responsibility? It scales up dramatically over time. You kick things off in CPEI with healthy clients. Then, in CPE2, you move into residential care, focusing on older adults and chronic illness. CPE3 drops you into the community, managing the continuum of care. And then it all climaxes in CPE4 with a massive 6-week placement in the incredibly high-stakes environment of acute care.
You can really see how the intensity ramps up when you look at the required hours. You'll dedicate 90 hours just mastering the basics, then 120 hours working with older adults, 65 hours navigating community practice, and finally, a grueling 200 hours dealing with acute illness, focusing on highly complex tasks like postoperative care, IV therapy, and those split-second clinical decisions.
Next up is Section 4, Preceptorship and Real-World Readiness.
So, after successfully surviving 475 hours of clinical practice across those 4 environments, you enter the ultimate trial. This phase demands another 180 hours. But listen, this isn't just another practice run. This is a faculty-monitored experience where you're working side by side with a fully qualified, experienced LPN, RN, or RPN. You are stepping directly into the daily, gritty reality of the profession.
This is literally where the training wheels come off. Your goal here is to prove, without a doubt, that you are fully practice-ready in a real-world collaborative environment. You have to demonstrate that you can take all that classroom theory, all those BCNM competencies, and all those clinical hours, and integrate them seamlessly into the fast-paced, unpredictable reality of the workplace. And finally, Section 5, Conquering the REX-PN Exam.
Because graduating from the 75-week program isn't actually the absolute end. You might be wondering, right? After 75 weeks and nearly 2,000 hours of blood, sweat, and studying, how do you officially prove to the medical community and the government that you are genuinely ready to practice safely?
Well, the good news is the program is designed to set you up for victory. Before your preceptorship, you actually take a transition course, and the entire curriculum wraps up with 60 hours dedicated purely to academic review and prep for the RX-PN regulatory exam. So they actively coach you right across that finish line.
And passing that specific exam, the REX-PN, is the ultimate key to unlocking your license. It's a hard, mandatory requirement to practice as a licensed practical nurse anywhere in Canada. It's the definitive proof that you possess the integrated nursing knowledge, the critical thinking, and the clinical judgment required for entry-level practice.
So we've walked through the entire blueprint. Knowing the sheer scale of this 1,965-hour commitment, the strict ethical and legal standards you absolutely have to uphold, and the intense, escalating clinical trials that are waiting for you out in the real world, the real question is, are you ready to take that first step on this 75-week journey? It's challenging, it's rigorous for sure, but for those who answer the call, it's the pathway to becoming an essential pillar of our healthcare system. Thanks so much for joining me on this explainer, and as always, keep learning.